Hi everyone, and welcome to Nayritta's Talk, dedicated platform to help you all find the right insights and the right information in the beauty and aesthetic world. Bringing education, sharing the latest technology, and introducing you to the best doctors. Today we're very fortunate to have Dr. Buthaina Shunnar with us to give her fruitful insight in this field. Hi doctor.
Hi, how are you?
Good, very good. How are you doing?
Alhamdulillah.
Good? Good. As we know, you are the first Emirati female plastic surgeon and the first American board certified plastic surgeon in GCC. So tell us more about yourself and your career path. Who is Dr. Buthaina Shunnar?
Okay, so I was born in Dubai. I'm Emirati. I ended up going to medical school in Ireland and subsequently went to the US to do my residency training. So I was there for about 10 years and came back in 2002. Worked in Abu Dhabi for 2 years and started my own practice in 2005. So I've had my clinic now for about 13 years. Both my parents are in the medical field. So obviously that has rubbed itself on us, my siblings, and we're very sort of into the whole medical field as a family.
That's lovely. So today we will be covering about the breast cancer reconstruction. So I know it is a very important topic, especially nowadays with unfortunately facing a lot of breast cancer patients. So can you just tell us more about this procedure on a plastic surgery?
So breast cancer is becoming incredibly prevalent. When I started medical school, it was a cancer that occurred on women in their 50s. Now we are seeing women in their late 20s to 30s with breast cancer. Now, there are many treatments of breast cancer, and in some of the treatments involves a mastectomy, and what a mastectomy is basically removing the breast. And this is very traumatic for a woman, especially in a woman who is in their 30s, for example. Now, with the advent of genetic testing, a lot of women can determine, especially with a family history of breast cancer, if they are what are their risks?
They have
the tendency, and what are their risks? If they are gene positive for that particular, like a BRCA positive for developing breast cancer, sometimes the recommendations is to remove both breasts even as early as in your 20s to 30s. For example, like Angelina Jolie, a very, very typical example. And you can imagine with that, you don't even have cancer yet, and yet you have to remove both your breasts. So breast cancer reconstructions is essential in women who are having mastectomy for cancer, but also in women who are gene positive that may get cancer, because they will be having bilateral mastectomies.
So you do recommend that kind of reconstruction?
In terms of breast reconstruction? Now, in terms of the mastectomies, I'm not the one who makes the decision who gets the mastectomy. The oncologic surgeon, the breast cancer surgeon that evaluates the patient, determines that this patient is going to get a
high risk or low risk.
Yes, or if they have breast cancer even. Yeah, so the mastectomies are referred to me after they know they are going to have a mastectomy, and basically my position is to offer the reconstruction, and the important thing is obviously is that you want both breasts to be symmetric. So if one mastectomy is going to be performed on one side, you want to make sure that when you do the reconstruction, you may also have to change the other side to make it symmetric. Or you would have to remove both breasts if the cancer surgeon recommends that. Okay? So
is there any side effects with this whole procedure?
Every procedure has side effects, and within the reconstruction, every type of reconstruction has its side effects. For example, there are several different ways to reconstruct a breast, and there's using an implant, and there's using tissues from your own body.
What do you mean? I want to know more about especially with the tissues. What do you mean with tissues?
So we do local flaps. For example, you can have a flap with the back muscle and to bring that forward to cover the implant, or if you have a fat back, for example, you could actually use that fat with the muscle and bring it forward to the breast. You can use your abdominal fat, just like you would do a tummy tuck, but instead of throwing it away, you would basically plug it into the breast area. And then you can use an implant reconstruction. Now, there is a shift more and more towards using implant reconstructions, especially for bilateral mastectomies. And it used to be a staged procedure where we would use temporarily an expander, and then we would do the reconstruction as a secondary surgery in terms of changing the expander to a permanent implant. Whereas nowadays there is also the introduction of what's called acellular dermal matrix, which is basically either human or cow skin. And so you can use that to cover the implant and transform the surgery from a two-stage procedure to a one-stage procedure, meaning they have the mastectomy and at the same time you can do the reconstruction so the patient wakes up with a breast. And psychologically and emotionally and sometimes and actually even aesthetically it's very, very pleasing and very common. So there is that trend towards, number one, doing an immediate reconstruction and also towards doing a reconstruction using an implant. Now I'm going to backtrack and also say that there are huge trends now and huge advances to doing the actual mastectomies itself. Meaning, we used to, in the past, the oncologic surgeons used to remove the nipple and all the skin, and you end up with a line across the breast. And nowadays there is a trend towards what's called a skin-sparing mastectomy, where you actually leave most of the skin, which obviously makes my life easier because I can then mold the skin according to how I would like to shape the breast.
And you just remove the tissues.
Exactly, the oncologic surgeon just removes the breast tissue from inside and leaves the skin. And there's also a further trend now towards what's called a nipple-sparing mastectomy.
But don't you think it might be a risk also to have it on the
So
side
the
of
important
skin?
thing is that the oncologic surgeon determines the size of the tumor, where the tumor is, can you leave the skin behind, can you not leave? So all that is assessed for sure. That's an important point. And the whole trend now towards what's called a nipple-sparing mastectomy, where if the tumor is away from the nipple, you can actually save the nipple, which obviously, cosmetically, has huge advantages. You know, God-made nipples are very different to man-made nipples, you know, even the contractions and all of that. So with the trend towards saving the nipple, if oncologically possible, the reconstructions then become much more aesthetically pleasing as well.
So doctor, there are a lot of plastic surgeons nowadays. How do you advise us to choose the right one?
Yeah, it's an interesting question. There are a lot of plastic surgeons and there's a lot of marketing. There's a lot of marketing and it's very confusing. I can totally understand. For sure, you have to, and probably the most important thing is to research the background of the surgeon. You have to make sure that they have a reputable board and that they've been in practice for a few years. The other thing is word of mouth. You know, if you have a friend that has had a good procedure, you know, I've had a lot of patients that are like, yeah, but my friend had it done and then I went to the same surgeon and this is what happened. Just because the first surgery went well, it doesn't necessarily mean the second surgery is going to go well. So researching the background.
And it's a tailored made. I mean, there are a lot of people, they just try to copy paste some, you know.
True, that's more of an aesthetic issue. Yeah. It's an interesting point. It's an aesthetic issue, but in terms of choosing your surgeon, word of mouth, and researching their background. You know, even I've been in practice now. I'm American board certified. I'm actually double board certified. I did general surgery, I did plastic surgery. I've been in practice now for about 20 years. And I still have people coming to me to tell me, okay, what are your qualifications? And I answer it because I think that's the right way to do it.
Of course.
You know,
and
I would definitely want
to be more comfortable.
Exactly.
Yeah.
Lovely.
So finally, doctor, what is your favorite makeover as a plastic surgeon? I'm sure each doctors, they have their own signature kind of a procedure or treatments. What's yours?
You know, it's a tough one. When I do a body contouring, I come out of surgery thinking that was my favorite procedure. I do a breast lift and augmentation, or I change the shape of the breast, I come out of there thinking this was my best one. The truth is, there's no question that plastic surgery has an aesthetic or an artistic flair. And what I love more than anything is to go in with a body that I know that I can transform somehow, and then finish surgery with the transformation that I had in mind. So I love body contouring, like, you know, creating a waist, and doing a tummy tuck, especially after, you know, women have had 6 or 7 children, and, you know, they come back to the clinic wearing lovely contour dresses, and they, you know, and when I see them, even forget about the surgery, when I see them wearing the dresses and the clothes, and they're dressing up, and the increase in confidence, it just makes my day. Yes. And again, likewise, you know, you see patients that have mastectomies, and then they come after surgery wearing a cleavage, you know, and wearing a dress with a low-cut dress. So I cannot tell you what is my favorite. It's almost like, in general, I would say, when there is an obvious transformation, regardless of whether it's breast or body or face, or it's just very satisfying.
Thank you so much, Dr. Buthaina, for being with us and accepting our invite.
And thank you so much for
So hopefully
me.
we'll see you also in your clinic, and we'll love to visit you in your clinic. Thank you. Thank you.